Hey guys, welcome to another video. Today I want to start a new series on the channel where I react to very rare medical conditions. So today we have a video here from 7 News about this little guy. He has some sort of rare condition. I think in the title or description they said it's called Fibrodysplasia Ossification. So we're going to see exactly what the video is about, and we're going to see what we can take away from this video. So let's dive right into the video, guys. So let's see here. Already from the beginning of this video, I can see that the child has a bit of a posture problem. Since they said it's ossification, so it has to do something with the bone.
Special is your little boy?
Very special. 1 in 2 million, that's how special. Literally 1 in 2 million. And born on Australia Day. He just gets more special every year.
Okay, you can see him clearly there. Yeah, you can see clearly there. So it's clear that the condition is affecting his bones. Dysplasia is a term where the normal body tissues are changed into a different form. There's a big protrusion right now on his back. I'm not too sure if it's a scapula or something else, but it looks like it's a scapula there. But yeah, let's look into the video and see exactly what's happening. But I just wanted to give you guys a quick insight into the terms, because honestly, I've never seen anyone with this condition before. So let's learn together and see exactly what this condition is about, because I've never seen a patient, like I said, with this condition.
Careful. Very slow, very slow.
Zach Armstrong is an Aussie battler. Is that high enough? What? 7 years old, and for much of his short life, his little body has been fighting a disease with a very big name. It's known as FOP, or FOP.
When Zach first got diagnosed, we used to say to him, do you know what FOP is? And he'd go, no, because he was only 2. And we'd say to him, you grow bones.
It can be tough on a child though. Of course, the child wouldn't really understand since he's young, and he wouldn't have experienced a normal life to know how a normal life feels. But it's still going to be very hard and difficult for the child, because he's going to have friends that live normal lives. So I know it's going to be hard for him. But I know it seems like his parents, his mother here, seems like they are a really good support system for him. They're going to make sure they do their best they can to make sure they can support him emotionally, mentally, and also physically, to make sure that he lives the best life he possibly could live.
And you grow bones, which are normal bones, but in the wrong spots.
Of the 7 billion people who live on Earth, only 800 have this rare disease.
Look at that. Out of 7 billion people, only 800 have this disease. That's how rare it is, guys.
And only 8 in Australia. A world away in a small town in Scotland.
Careful and you cut yourself.
19-year-old Louise Wedderburn is baking with her mum. Neither of Louise's arms can bend.
Oh, so she has the same thing as well. So we saw that the bones can actually protrude or grow abnormally in certain locations to cause the deformity.
Knees are stiff. Her spine locked.
Basically, it is where your connective tissues and your muscles and everything slowly, gradually turn to bone.
You guys heard it there. That has to be a difficult life, to be honest.
Yeah.
Because FOP slowly stiffens the bodies of sufferers, they begin to resemble mannequins, which is why it is sometimes known as the human mannequin disease. There's no cure, and most will be in a wheelchair by the time they're 30.
Shucks, man. That's tough.
With each passing day, life becomes harder.
That's the thing, because like they said there, it's a progressive disorder. So eventually they won't be able to move at all. Now she can move, but that's going to be limited as time goes by. The little boy was able to move more because he's still young. But unfortunately, it's going to get to a point where it's going to get worse, unfortunately. But I hope that somewhere in the future, somehow, they can find some sort of cure. If not a cure, at least some way to like reduce it, man, or slow it down, the progression of the dysplasia. I really hope so, man.
I can still do everything I want to do, but just sometimes in a different way than everybody else.
You've called it the master key to the skeleton.
It is the master key to the skeleton because this one mutation, this one genetic change, this one letter change out of 6 billion in our entire genome allows the body to turn one organ system into another. And so here is the trapdoor in evolution, so to speak, where the body could, if it wanted to, create one organ system out of another.
Yeah. You see how rare it is, guys? Because the body has a bunch of genes, and depending on the sequence of those genes is what we're going to see in the actual expression of our character, physical, mental, and so. So just one mistake can cause serious complications like this here. So that's why I have to tell you guys, of course we all have our problems, but life could always be worse. There are many people out there who have it worse off than us. For me, for example, I have IBS. Sometimes I feel horrible, yes, because I can't always eat any and everything that I want. I have a bit of lactose intolerance as well too. But that's very small compared to so many things that a lot of people go through in this world. So I'm really thankful to God that I'm in a really good condition, and we all should be thankful for our condition that we're in.
Lauren, tell me what Zach was like as a baby.
Pretty much a normal baby, a very happy baby, never cried, never complained, never whinged.
Yeah, it looks pretty regular, no problems at all, only formalities.
A joy. I had an easy ride. Socks.
The only thing out of the ordinary was little Zach's big toes. Because so many doctors have no knowledge of the disease, they miss this simple sign that gives it away. Zach went undiagnosed, then later was misdiagnosed. When he was 18 months, his mum Lauren took him to the doctor with swollen eyes.
That's the thing, because like I said, in medical school, standard important things, they teach you how to understand things better, how to figure things out, how to reason for yourself. But of course, in medical school, you can't learn everything. They can't teach you everything. Our medical school, we never learned about this condition before. And like I said, I've never even seen this condition before. But I know what the terms mean. So I can understand exactly what's going on. But now that I'll be actually seeing a person with the condition, it now makes everything clear.
She was told it was an infection.
With this infection, they gave us a course of antibiotics and more or less sent us home after the treatment. And then from there, it got worse.
Yeah, you can see on his forehead here.
A biopsy was ordered, and that was the worst possible thing. FOP reacts to any kind of trauma by turning nearby muscles or tendons to bone.
That's next level, man. That's interesting.
The biopsy needle kicked the disease into overdrive. Zach's mum could only watch helplessly as his body went from normal to abnormal in rapid time.
And I can imagine as a parent, like you seeing your child going through this, newborn, you lived so many years, healthy, normal life, newborn, innocent, going through so much pain, so much trauma and suffering. It's gonna break you, man. It's gonna break you. So props to this mother here for being so strong, because most parents, it would destroy most parents, to be honest. It's tough, man. It's tough. You're seeing your child change in front of your eyes and you don't know what's going on. Even doctors can't even answer.
It would change every 5 minutes. It looked like something was moving under his skin. It was amazing. I've never seen anything like it. It was just very, very aggressive.
It just got worse for Zach. When he was 4, the disease caused his jaw to dislocate. Doctors operated, and during the surgery, Zach stopped breathing. He was given an emergency tracheotomy.
Yeah, man, because once you see conditions like this, these conditions here, you have, it's like a gateway to many, many other health complications. Because so many things can go wrong, guys, in the body at any time. And when you see you have certain genetic conditions, it increases the chances or the likelihood of complications happening. I remember muscles are everywhere. They line all of our organs. So that's the reason why you can see so many complications.
Putting a breathing tube in his throat.
You want a suction? Can we quickly? Sorry, guys.
But again, his disease reacted violently, growing new bones that locked up his vocal cords. The vocal boy in this video was left voiceless. Explain all of this to Zach.
He used to say, "Why don't I talk anymore?" He doesn't like hearing his voice on videos anymore. He doesn't look back. He just
Okay, so apparently, yeah, it has hindered him permanently.
keeps going. He moves forward. That was then. This is now. This is what I want to do now. Let me hop in. Come on.
Oh yeah, you can see there. The tracheal tube is there, yeah.
Morning, Zach. How are you today? Good? Good morning, Julie.
And what Zach wants to do more than anything is to be like any other 7-year-old.
Do you love all the Lego?
Wow, look at that.
So mums put him in a regular school, in a normal grade 1 class.
That's good, man, for his mental. Of course, unfortunately, there are going to be people in this world who are going to try and bully him. But I think the best thing for him is to have a normal life as much as possible. I really think that's the best for him indeed. Because if you shelter him now, he's going to be isolated. And of course, isolation can lead to depression.
Here we go. You can show them the pictures where you got it from.
Zach communicates with his teachers and classmates by making sounds.
You're making it?
Or mouthing words.
Is that a bus? Yeah, oh, the V-Dove.
How proud are you when you see him do his little show and tells and use the iPad?
Love it.
Zach, have you got that?
This is a good friend here, man. This guy is a good friend here.
That. Do you wish you had it?
Would you like it? Yeah. Oh, you'd like the car.
Oh,
Turn it around and show everyone which one you would like.
You're going to have to teach him sign language then for him to communicate.
We never thought he'd make it preschool. We never thought he'd make it to school. To watch him go from being ventilated on a machine to learning to walk, to communicate. Got told he'd never speak again, never eat again. Had 3 months of rehab on trying to walk. And to go. And
The good thing is once the brain is intact, the body will function. So learning wouldn't be impaired. Understanding or anything, cognitive abilities would not be impaired. It's just the actual movement, the physical movement, mobility is going to be impaired for him. And of course, yes, it can affect other organs too, but so far it doesn't look like it affected anything seriously.
start school and all these things, just amazing.
Zach's misdiagnosis and subsequent mistreatment has accelerated his disease. Eventually, his bones will suffocate his heart and lungs. The average life expectancy is 41, but no one knows how much time Zach has.
It is tough, man. It is tough to be hearing these kind of things. That's why you have to be appreciative, man. And I really hope that's one thing I like about AI. Like, I really hope everyone can just work together. All fields, AI, the medical field, lab technicians, like everyone. I just want everyone to work together to just create amazing things for this world, man, health-wise. So cures, medical devices, improving patient treatment, patient care. Like, I just want everything to be improved, man, for everyone, to be honest. And that's one thing that I really, really like about AI, because AI is going to speed track that. It's going to give us the best opportunity to be able to actually pull that off.
There are some hard days, though.
A lot of hard days. I've never cried. Even when Zach was diagnosed.
She's strong, man. She said she never cried. Respect to her, man. Respect to her, guys.
Sorry.
Don't ever be sorry. We have seen a very beautiful, happy boy.
Oh, he's amazing. He really is.
Do you ever think, why us?
Never. I never ever asked myself, why me? It's my fault. Why did I get this?
That's the thing, guys. It's sometimes it's very tempting to ask God, like, why me? Why do I have to go through this struggle? Why do I have to experience this? Why am I diagnosed with this problem? Financial situation, relationship, whatever it is, why me? It's very tempting to do that, but you have to realize it could have been worse. We can't really understand why we go through certain things, why certain things happen to us, but we always have to make sure we remember that it could be worse, and we do whatever we can to make the best of the hand we're dealt. Some of these things here, they're like a way to like help move humanity forward, because it's going to give people the opportunity to now work on this condition here to find a cure, or to find some sort of treatment that's going to make the person's life even better. So the person born 15 years from now, 20 years from now, with the same FOP condition, they're going to have a better chance of living a normal, healthier life.
Child, never. I'm glad he's mine. I wouldn't want anyone else to have him. I really wouldn't. And that's the truth. I've never, ever, ever asked. Just got on and done it. Had to.
Anyway, guys, I think we've seen most of the video already. I don't know what they're going to show, but if they show anything else that's interesting, I'm going to add it in the video. So apparently there are some scientists who are working on the actual condition. So let's see what they're going to say about this disease here.
It is very interesting.
At the University of Pennsylvania, Dr. Fred Kaplan and his team have spent a quarter of a century studying this mysterious disease.
We did a study and we found that 90% of patients were misdiagnosed worldwide.
And Dr. Kaplan, who's never charged an FOP patient, is quietly confident they're close to a cure.
That's what we like to hear, guys. That is exactly what we like to hear. There are many, many health problems, conditions, diseases that are in the world right now, and we have a lot of people, very smart people, round the clock working on them to find a cure or some sort of treatment for these conditions. And that's what I'm really happy about. So let's hope that this doctor here and his team, and maybe even others too, can find an actual cure for this condition so that people can actually live normal, healthy lives, or at least a better life.
They've identified the mutant gene. Now they're working on how to turn it off. And just as exciting would be the ability to activate the gene, to turn it on and grow new bones. Solve that secret, and the treatments would follow for osteoporosis, osteoarthritis, bone cancer. They could help prevent heart disease, heal fractures quicker, even help regrow missing bones.
That's really huge, man. That's really huge. If these guys are able to pull this off, that's going to be revolutionary for medicine. But yeah, guys, thanks for watching this video. I do want to tell you that sugar is very, very dangerous if you consume too much of it. And I have a video talking about that here. So if you want to go and see that, then click here to see that video. But yeah guys, thanks again for watching this video. Do like and subscribe for more health and wellness videos like this, and I'm going to catch you guys in the next one. So take it easy. Peace.